On today's CityLine, it's Makeover Madness. Well, what in the world is going on? There are men everywhere who all of a sudden want to look as good as us ladies want to look. I don't know if it's the media, I don't know if it's us putting the pressure on them. We've got Dr. Stephen Mulholland here and Dr. Jordan Saul, Aesthetics and Dentistry, Spa Medica, to talk to us about this new phenomenon. So of course, you know, I went to the only person I could in the audience, this poor gentleman in the back in the stripes. Give us a wave, hi, because I was grilling him before the show. So you've never wanted anything done ever? No. He's like, no, I'm pretty happy with myself. But there is this new breed of guy who is out there and is interested in cosmetic procedures. So tell me a little bit about that. What are you seeing more of that in your client base?
No question about it. When I started in 1995, 96, I saw one guy the entire year.
Okay.
One guy. This past year, fully 10% of all cosmetic procedures. So about 100,000 men in Canada get some type of physical cosmetic enhancement.
What are they getting done?
Well, you divide it into surgical, non-surgical. Non-surgical would be Botox, soft tissue fillers, hair removal in unwanted areas, hair restoration in desired areas. Those are the top things men do. And then surgically, they get the bags treated, the double chin treated, the 50-year-old male boobie treated, and then love handles. Those are the top 5 things that guys get.
So no breast augmentation then?
That would be making them smaller, yes.
Making them smaller, not bigger. Okay, so let's take a look at Carl, who came into Dr. Mulholland's office for some anti-aging procedures.
When you look in the mirror, what are the top 3 things that bug you? What's bugging you?
Pouches under the eyes.
So pouches under the eyes.
Tired look half the time, even when I feel energetic, you know, and this stuff here, the little lines.
There's still very much in culture, in our Western culture, a taboo or some type of stigmatization of males having cosmetic procedures. For men, it's still very much a closet thing.
I already put a lot of focus into, you know, yoga, eating well, exercising, all of that, and I wanted my face to reflect that.
What we did with Carl was a very common constellation of treatments that I do with guys. First of all, make the skin look even and clean. For most guys, skincare is like Irish Spring. And so we had to bring him into, you know, how to look after the skin. So we did photofacials, which evened up the broken capillaries and the redness. Then we evened out his pores and his texture. We used Botox in areas where he was looking very worried and angry in his forehead. Very simple guy makeover.
It's been a nice, subtle change, you know, where essentially you're just winding the clock back a little bit, but, you know, essentially I look the same as I did before. You know, it's just that I look the way I looked 5 years ago, 6, 7 years ago, as opposed to the way I looked 6 months ago.
Yep. Well, you know, in a lot of cosmetic surgery, you find that subtle is the name of the game, right?
So true. Well, Carl's very much like most guys. They do it for what I call B&B, bedroom and boardroom. That's why they do it. They do it. They do it because they need to look good in their job, and they know that they are judged. The book's judged by its cover, and know they're looking for a new relationship or getting out of an old relationship. The same motivations as women. We've just been less likely to admit it.
And yeah, more men are saying now you need this to stay in your job. You're not allowed to get old anymore, or to get that job, right? You've got to have a certain appearance. So I call it the George Clooney effect. Everybody wants to look like George. He's just a hot-looking guy. Do you approach men's faces a little bit differently than you would approach a woman's face?
Totally differently. In a man, you want to preserve the maleness of that look. So it's about a strong jawline, I can take you anytime looking jaw.
Ooh.
Not that Madonna lift or big feminine cheeks. And the goal is not to erase lines and wrinkles. In fact, to just allow the lines and wrinkles to help define and characterize them. So it's very subtle. And if you look at the results of well-done guy procedures, you don't think he's had a procedure. You say, wow, he's looking good. He's looking healthy, looking vibrant, fresh.
Okay, can we talk a little bit quickly before we talk about teeth? Botox and Juvederm, what are the effects of each one?
Botox softens really strong muscles. For example, Carl made a comment that his wife always misinterpreted that he was angry. He was angry at her. And when she saw him with the Botox, just in his frown area, she said, wow, for 10 years, I've always thought you were irritated. You know, you just move a lot. And so Botox softens movement, and Juvederm is one of the more common fillers, so it adds fullness. I enhanced his jawline so he looked more Clint Eastwood, Newt Rockney-ish. Yeah.
Very cool.